Have you ever heard about diabetes? Are you aware that diabetes is very deadly? Hello everybody, thank you so much for joining us on this edition of the program You're in Your Health at on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Diabetes is considered as a silent killer. According to the World Health Organization, about 422 million people worldwide have diabetes. Majority of cases are living in low-income countries with 1.5 million deaths directly attributed to diabetes each year. Both the number of cases and the prevalence of diabetes have been steadily increasing over the past decades. Thank you so much for choosing Equinoxe Television. Accompanying me here in this program is AC Lucy Lengu, my co-host. Hello, Lucy.
Hello, Immaculate. Hello to our listeners and viewers out there.
Our guest today is a public health consultant. He's known as Dr. Ahmed NFOR. It's a pleasure to have you on the program.
Thank you very much, Immaculate. Thank you, Elsie, for being with you in the studio this afternoon.
A pleasure.
Doctor, today we'll be looking at a very sensitive topics. A lot of Cameroonians are suffering with this particular disease. In the simplest terms, could you define us what diabetes really is?
Diabetes is a condition where the blood sugar levels in the body goes higher than normal. This could be because the pancreas is not producing enough insulin or because the body is not responding to insulin. I think this is one of the most deadly health complications that we have outside there.
Now, when the body does not respond to insulin, what does that really mean? How does this affect the system?
Okay, there are so many consequences or health complications which are brought by diabetes. When the body is not responding to insulin, it means sugar levels go high, as I defined before, and the complications can result into heart attacks. It can lead to things like stroke. It can lead to atherosclerosis. It can lead to nerve damage, what we call neuropathy, where you have numbness and being able to feel or get sensitivity to touch. And then we also have a retinopathy, where it leads to blindness or blood vision. You see some people complain, I'm not seeing well. It could be sugar. We have amputations. Sometimes it becomes very complicated when diabetic patients are faced with wounds. In the long run, the wounds will not heal because the platelets, which are responsible for healing of wounds, have been damaged by high levels of glucose. So there's amputation, the part of the organ, it has to be cut off. We also have sexual dysfunction. I want to tell you that 7 out of 10 men you meet outside who are above 50 years are suffering from sexual dysfunction. Though there are a group of risk factors where diabetes is one of the risk factors for sexual dysfunction. Then we also have kidney failure. Most people with high level sugar can have problems with kidney, which will require dialysis.
And now, before we go ahead, Immaculate, we are going to give our numbers for those who have questions. 670-547049, 670-547049, and 656-62-2222, 656-62-2222 at the end. And now back to you, Doctor. We are looking at diabetes. What is type 1 diabetes?
Virtually, diabetes is classified into two types, as you rightly said. There's type 1, there's type 2 diabetes. They are classified in this way because they are, the primordial cause are different. Diabetes type 1 is when the immune system, which is meant to defend your body from pathogen or from invasion by pathogens, end up attacking pancreatic cells, the cells in the pancreas that produces insulin. And so in this way, the pancreas now lacks the ability to produce insulin or produce insufficient or inadequate insulin, causing the sugar level to rise. This type 1 diabetes is congenital because it's caused by mutation, a change in DNA of an individual, maybe during reproduction, can lead to this type 1 diabetes. It's congenital, that it can move from one family to another.
Yeah, we have clearly defined type 1 diabetes. What is type 2 diabetes? Are they the same?
Okay, no, they are quite different. Type 2 diabetes now it involves a pancreas actually producing insulin. The cells are there, they are active, but the insulin produced is insufficient to convert the excess sugar which is in blood. This could be as a result of what we call insulin resistant. The insulin is there but it's resistant, means it doesn't react with the glucose that is available in the system.
Okay, from the beginning you made mention of some risk factors already. Now we want to know, is dieting important and physical exercise, are they important when we are trying to reduce our blood sugar?
Yes,
level?
dieting is very important because most of the diet, 90% of the diet we take in tropical Africa or in Africa as a whole is related to carbohydrate. And the end point of digestion of carbohydrate is glucose, which therefore means we have to be careful when we are consuming. For example, those already who are diabetic, consuming a lot of rice or a lot of fufu, corn, a lot of water fufu, carbohydrate food, they have to do what we call intermediate feeding. Maybe you have to consume 4 loaves of fufu corn a day. You consume 1 after 3-4 hours, so that you give time for the sugar to be used before another sugar is introduced. Or completely you reduce the intake. And then they are also eating late. Those who eat late, when I said eating late means eating and going to bed maybe in less than 3-4 hours, the excess sugar in the food may have no access to go because there has not been good metabolism. So the sugar in the food may move straight away to the blood and increase blood sugar. And then secondly, when you do a lot of exercise requires energy. As you do a lot of exercise, glucose is being burned through metabolism, through oxidation, to produce energy so that there's muscular contraction. And so when people are inactive, most people who are inactive may end up having diabetes. Then you have obesity, what we call BMI, body mass index. Those who are fat, 85%, research has shown that 85% of fat people are prone to diabetes because overweight leads to insulin resistance. Means the insulin will be there, but will not be able to convert sugar to another form to prevent the body from damage.
Now, what are some risk factors that can make someone to develop diabetes?
Now, those who are very prone to diabetes, as I already even start mentioning, we first of all have overweight, obesity, and then we have people who are inactive, who are doing sedentary job. You have an office, you sit there from morning till afternoon. You don't go out, no exercise. There are some, these people are prone to diabetes. And then secondly, people who consume, research has proven that those who take carbohydrate drinks, 2 bottles a day, can be prone to diabetes. Carbohydrate drinks, we have them much packed outside there. Some people drink, when you take a bottle, it's enough. But 2, research from all medical centers has proven that it could lead diabetes. It could lead to diabetes
What are
over
some of
time.
those drinks? So, because a lot of people may just hear carbohydrate.
Most carbohydrate drinks, we have canned drinks. Canned drinks are mostly carbohydrate.
Okay.
We don't talk about plastic drinks, which are maybe a concoction of sugar and water. But we will talk about sugar and water, which is still glucose. But most canned drinks are highly concentrated with carbohydrates.
We see a lot of people taking this energy drinks, and they say it's because they are very weak, and they tend to take it almost every day.
Exactly. The most energy drinks are carbohydrate drinks, carbonated drinks. And we are cautioning that people should take at least once a day. Taking in excess, the sugar will not be used by the body, and you may have crisis of diabetes. We also have people with high blood pressure. High blood pressure is a potassium deficiency, which make the blood vessels narrower and difficult for blood to flow, causing some blood resistance. So these people who are hypertensive can be diabetic. And people who are diabetic can be hypertensive because they are twin complications. And then in addition to that age, when somebody approaches the age of 35 years, there are chances of developing some of these complications because the organs start dropping in their functioning. So you have to be more careful. Then you have cholesterol. Most people go to the hospital, the doctor writes in their medical book, LDL, capital L, capital D, capital L, dictated. Maybe they may not explain to you. This stands for low density lipoprotein. This type of fat is not needed by the body. It's called cholesterol. We have 2 of them. We have HDL, high density lipoprotein. That's what the body needs. The 80% of the fat in our body is low density lipoprotein, which is the body does not require. So it causes diabetes.
And now, how is diabetes diagnosed, and what's the normal blood sugar level?
Normally, we have different tests that is used in carrying out diabetic tests. We have the fasting blood sugar glucose test, where they allow you, after 8 hours of not eating, your blood sample could be collected and tested for sugar. If it varies between, if you have the levels which vary between 120 deciliters, 120 deciliters up milligrams per, that's 120 milligrams of deciliters of sugar in your blood, you are diabetic. And if you have 100 to 125 milligrams per deciliter of blood, you are pre-diabetic. You are not diabetic, but you are moving towards diabetes. This is fasting blood sugar test. That's the one commonly used outside there. And then we have what we call oral glucose tolerance test. Means after this fasting blood sugar test, we go back to the oral glucose tolerance test. You are allowed to drink 2 to 3 bottles of sweet drinks after 8 hours of fasting, then a test is being conducted. And if the result, you have 200 milligrams per deciliters of sugar in blood, then you are diabetic. And you have 140 to 199 milligrams per deciliter of blood, you are pre-diabetic. So above 199 now, you are diabetic. So this is what we call the oral glucose tolerance test. These are the common tests which is carried by most hospitals in Cameroon today. There are some other traditional methods of testing diabetes, which briefly I can just do it as maybe en passant, just to enable people. Sometimes the urine test can be done by urinating, where you have a group of ants. Your ants are social insects, they all scrap together. You urinate there. You observe what happens after 1 hour. If you see ants crowded on your urine, there's a possibility that there's sugar in your urine. There's also a possibility that can be diabetic.
And now, type 1 and type 2 diabetes treated the same?
Actually, the type 1 and type 2 are treated using different methods. Type 1 diabetes is called insulin-dependent diabetes, because I've told you that it's a result from the attack of the immune system attacks the pancreas, destroying the cells that produce insulin. So now they are giving insulin injection. You have to be injecting yourself. That means artificially prepared insulin to boost the insulin level in your body so that sugar conversion can take place normally. While in type 2 diabetes, you are giving, there's one drug which is very effective. Those with type 2 can only take insulin when it goes to chronic. But most of the people in type 2, they are giving a very popular drug called metformin, glucophage. That's what most people who have diabetic type 2. And this drug helps to boost our insulin and then prevent insulin resistance and boost our insulin production. This is one of the highest, most recommended treatment for type 2 diabetes. And that's the most commonly used.
Let's look at briefly some common myths that we have in our country. What are some myths about diabetes?
Yes, the conception that some people may have by diabetes is that diabetes can be cured. We don't cure diabetes. We treat diabetes. There is a difference between treatment and cure. Treatment is reducing the effects of signs and symptoms or the risk factors from the system, while cure is completely eliminating. So there's no way you can completely eliminate sugar from somebody's system, because we need sugar on daily basis, on hourly basis. So diabetes is treated, not cured. And then another problem too is that some people think that since in their family there's no history of diabetes, they may not have diabetes. If they go about consuming any kind of food, drinking any kind of drink carelessly without being active, they will develop diabetes, though nobody in the family has diabetes. So that idea of congenital diabetes, family history, has its limits too. So we have to be careful. And then another people think that when you have diabetes, means your life is all ruined, you cannot do anything yet, you are helpless. No, they don't give a diabetic leave that you have diabetes, go and rest. In America, we have the National American Diabetic Society. And then most well-structured countries, they have diabetic society, cancer society. These people are being canceled. You go on your normal daily activities. You even need to be more active and be more serious, more energetic when you have diabetes. You don't need to be sedentary.
Okay, doctor, time is against us. I'd like to thank you for taking part in this program. It's really a pleasure having you. Thank you to Lucy for being part of the program. That was Dr. Ahmed NFOR. He is a public health consultant. And that's what put an end to today's edition of the program. You're in the health ed on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Received technical assistance from Jonathan Babiola and Bertrand Bonzini. Have a lovely day in the company of more interesting programs on Equinoxe Radio and, of course, television. Bye-bye for now.